55-year-old male presented with recurrent episodes of melena with easy fatigability. Physical examination was unremarkable except for signs of anemia. Routine investigations revealed hemoglobin of 3.2 gram per deciliter, hematocrit of 16.4%, MCV of 65, WBC of 3100 with differential count of 21% neutrophils, 49% lymphocytes, 10% monocytes and 20% eosinophils. Guac test for stool was positive. Stool tests for ova and parasite were negative. EGD and colonoscopy were normal. Patient underwent capsule endoscopy to rule out small bowel bleed. Capsule endoscopy revealed multiple hookworms seen in the distal duodenum and jejunum. The parasites were seen attached to the mucosa of the intestine, sucking blood with adjacent hemorrhagic spot indicating previous attachment site. Patient's hemoglobin during course of treatment improved from 3.2 to 12.8 gram per deciliter after packed red blood cell transfusion, antihelminthic and iron supplementation at 6 months of follow-up.
About the method. In tropical regions, one of the more intriguing causes of significant small bowel hemorrhage is the presence of infectious diseases that are endemic to these areas. Conditions such as typhoid fever, caused by Salmonella typhi, can lead to intestinal complications, including ulceration and subsequent bleeding. The pathophysiology involves the bacteria invading the intestinal mucosa, which can result in the formation of ulcers that may erode blood vessels. This scenario is particularly concerning in regions where sanitation and access to clean water are compromised, as these factors contribute to the prevalence of such infections. About the method. Another notable cause of massive small bowel bleeding in tropical countries is the occurrence of parasitic infections, particularly those caused by organisms like Strongyloides stercoralis or Schistosoma mansoni. These parasites can cause significant damage to the intestinal lining, leading to inflammation and ulceration. The resultant bleeding can be severe, especially in cases where the infection is chronic and untreated. The interplay between the host's immune response and the parasitic invasion can exacerbate the condition, making it a critical area of concern for healthcare providers in these regions. About the method. Lastly, the incidence of trauma, whether from accidents or violence, can also contribute to massive small bowel bleeding in tropical settings. In many developing countries, the prevalence of road traffic accidents and interpersonal violence can lead to blunt or penetrating injuries to the abdomen. Such traumas can result in lacerations or perforations of the small intestine, leading to significant hemorrhage. The management of these cases often requires prompt surgical intervention, highlighting the need for improved trauma care and preventive measures in these regions to mitigate the risks associated with such injuries. Thank you for watching. Subscribe if it is useful.